Wisconsin Radio Network is ready? Okay, yeah. We don't want to discriminate against radio. So.
You got print right there for crying out loud. Right?
Yeah, okay. Well, we're all print is always ready. So, good morning, everyone. Thank you for joining us. My name is Robert Craig, Executive Director of Citizen Action of Wisconsin, and we are joined by State Senator Jon Erpenbach, Representative Melissa Sargent, who will also speak. And we actually have something to say that is positive and constructive and moves us forward, actual incremental change that will actually save healthcare consumers a lot of money. So there's a little backstory, and there's a sheet I've handed out which explains what these plans are. But the federal government actually came up with something called, a standardized plan, which isn't that descriptive, so we're calling them low out-of-pocket health plans, which were standard, and they encouraged states to adopt them and insurance companies to adopt them. And the good thing that they do is that they have zero deductibles for a number of high-value medical services. So a doctor's visit, no deductible, for example. A specialty visit for a specialist, no deductible. A mental health visit or substance use disorder treatment, no deductible for outpatient. And no deductible for generic drugs, for preferred brand name drugs, for non-preferred brand name drugs, and even for specialty drugs. Now, the deductible, of course, is what you pay prior to actually your insurance kicking in. There are still copays and there are still co-insurance, but they're manageable. So, for example, generic drug is $30. A preferred brand name drug is $50. A primary care doctor visit is $30, just for example. And there are more examples in the handout. Now, this was voluntary in the sense that states didn't have to require all insurance companies to do it. And so unfortunately in Wisconsin, which has been a pattern, the state of Wisconsin did not require this. And so it's entirely up to the individual insurance companies whether they'll provide these low out-of-pocket health plans or not. And to try to fill the breach, so to speak, and to make this happen, members of Citizen Action across the state and of our organizing co-ops and members of the state legislature in the what is called the minority party, i.e. those who cannot schedule bills and get votes, actually lobbied for this. And the result is that we know of 5 insurance companies that are going to be providing these low out-of-pocket plans. There may be more, they just didn't tell us, even though we asked them repeatedly. And so the ones that are doing it are Group Health Cooperative of South Central Wisconsin, which serves a lot of people here, the Arise Plan of Wisconsin, of WPS, a Madison-based company, Network Health, Molina Health, and the Common Ground Health Cooperative, which is the eastern side of the state, are definitely offering these low out-of-pocket plans. And they have a lot of customers, so that adds up to a lot of savings. In fact, it adds up to, according to our analysis, to over $226 million in savings, and that's on page 2 of the handout in terms of consumer deductibles they would have paid for these medical services if you didn't have these options. Now, so that's a great thing. We should do more. We should require all insurance companies to provide these plans. We should do other things to rein in prescription drug costs and health insurance costs and the underlying medical costs, because in fact, Wisconsin, we now know, has the second highest medical costs in the country, following Alaska. So there's a lot more to do. I don't want to say this is it, and we've solved the healthcare cost crisis and the prescription drug cost crisis. But this is a step forward, and it shows that if you put public pressure on, that there are a number of insurance companies that are willing to do the good thing and to make some step to make healthcare more affordable. We know that the big issue now is not just premiums, but it's deductibles, and then it's co-pays and it's co-insurance, and this deals with all of that, and it deals with rising prescription drug costs, which is a huge issue. And the problem with a lot of insurance plans is they're so complicated, no one knows what's going to get covered. They have high deductibles. Often they pay thousands of dollars before they can get any insurance for prescription drugs. And that's a huge problem. It's unaffordable for a lot of working families in Wisconsin, as incomes have actually declined since the year 2000 in real terms, not increased. But of course, insurance rates, like college tuition, quite the other way around, and medical costs. So with that overview, I want to turn it over to Senator Jon Erpenbach, and then we'll have Representative Melissa Sargent comment on this. So thank you very much for coming, Senator.
All right. Thank you, Robert. I appreciate it. I'd like to commend Representative Chris Snicki on a ringtone of Maggie May by Rod Stewart,
So sorry.
which is substantially better than Air Supply's I'm All Out of Love, which I've heard before too, which obviously that person has some issues they probably should be taken care of. Robert, thank you very much. I appreciate the invitation today. You know, working families here in Wisconsin have struggled for a long time with high quality, affordable health care. And in recent years, deductibles, as we have seen, have risen faster than average wages. And even with the passage of the Affordable Health Care Act, health insurance companies have found a ways to squeeze consumers to increase their bottom line. The federal government stepped in and to design a more affordable insurance plan they encouraged all companies to offer beginning next year. The plans were to be simple, easy to understand, and include much lower cost sharing than what's on the market today. The problem with that is the federal government left that up to the states as to whether or not they were going to actually offer those plans. In Wisconsin, as we know, we have a governor who is more interested in making sure that the Affordable Care Act won't work than he is in providing people of Wisconsin with affordable health insurance options. So today, I really do want to thank Citizen Action and its members for working to encourage insurance companies, and they worked hard at this, to do the right thing on their own and provide those options here in Wisconsin. So again, to Citizen Action, thank you so much for doing the job that we really wanted to do, but we're stopped by the Republicans pretty much every single step of the way. Thank you.
Thank you very much, Senator. And I do want to recognize the faith community is very interested in healthcare costs. It's a moral issue as well. And so we have Peter Bakken here from the Wisconsin Council of Churches, and we have Rabbi Bonnie Margulies here from the Wisconsin Faith Voices for Justice supporting this. So thank you very much for coming. And I want to turn it over now to Representative Sargent, who, like Senator Erpenbach, has been working really hard, often stymied, but working really hard to address healthcare access and healthcare costs. So thank you, Representative.
Thank you. So today we get to celebrate yet another example of a problem that's been solved by our friends, the advocates on the outside, as well as the private industry in Wisconsin, where they're leading and the government is failing. And they have led us to do the right thing in the state of Wisconsin. And I think that's fabulous. And I want to thank Citizen Action, and I want to thank these insurance companies for stepping up and taking care of the people of our state in the way that Wisconsin really values. Unfortunately, what we've seen under the current Walker administration is over and over again, the policies that are made in this building are not the policies that are helping ordinary, everyday Wisconsinites move ahead and take care of their families in accordance with our values. And that's really unfortunate. What we know now with these 5 insurance companies is that we are going to be saving people all over Wisconsin, our friends and neighbors and our family members, over $200 million in out-of-pocket expenses, money that they are going to end up spending to buy new shoes for their kids, to eat out at mom and pop family restaurants, and maybe even to buy a new washing machine to do their family's laundry. This isn't money that people are not going to be spending in our neighboring, on our Main Street shops. So it's something to remember that this is money that we are infusing into our economy of Wisconsin. So that's a win as well for our normal businesses. And we need to applaud this type of innovation and problem solving, where again, our state government should be stepping up, because it is the role of state government, our laboratories of democracy, to make sure that we're taking care of the people of our state and adding health and security so that prosperity can move forward. And unfortunately, that's not what's happened under our current administration. And until Wisconsin straightens this out, we're going to continue to struggle. Our middle class continues to struggle in a way that is completely unacceptable. And it's making our children and our grandparents suffer, and we should not be in that situation. I think it's absolutely fabulous that we're able to celebrate this decision today, and that we're able to applaud the decisions made by these health insurance companies so that we can create zero deductible and low deductible plans for the people of our state. But our work is not done. So while we are celebrating right now, I want to make sure that everyone realizes that there is room for improvement, a lot of room for improvement across Wisconsin and in fact across our nation. Currently, Wisconsin is the second highest healthcare costs in the world. And with the innovation and our history of rolling up our sleeves and doing the right things for our communities and a forward-thinking state government, we should be the second lowest healthcare costs. But unfortunately, that's not the case. And we can't continually be relying on the private sector to do this all on our own. So once again, I want to applaud Citizen Action and our hardworking people all across Wisconsin for being the ones that are shining the light on what is it that's not working, and bringing transparency to what is that's not working, and leveling the playing field for everyone in our state, regardless of their zip code. regardless of their income, and regardless if not, they feel like they have a voice in the state capitol building. Because everyone, absolutely everyone in the state of Wisconsin deserves affordable and quality, high quality health care. And I know this is not a partisan issue, because in fact, more than 70% of the people in the state of Wisconsin, when asked, believe that we should be accepting Medicare expansion dollars and taking care of the people of our state with health care. That's the right thing. That's what we should be doing in Wisconsin. So what we're seeing today is a clear illustration that what Walker and his GOP allies are continuing to fail the everyday people of our state. However, we can move the pendulum forward with really healthy coalitions like Citizen Action and our private healthcare providers to take care of everyday Wisconsinites. Healthcare costs continue to rise. People continue to be uninsured. They continue to have a knot that is really complicated, and they're trying to untangle it and figure out what is the right thing for my family. And we can improve on all of those things. So absolutely, let's celebrate the step in the right direction, but know that we need to do more, and there is more that we can do, because what we should be thinking about is how we can help all of the people of our state, rather than how do we do less for less. Thank you.
Thank you very much, Representative. And obviously want to thank not just her ringtone, but Representative Sinicki for joining us. It is a great ringtone, though.
Rocks.
Yes.
Rocks. Sorry.
And I want to point out, and these are the companies that are doing it. I want to point out they do get one benefit for doing the right thing, and that is when people start enrolling on healthcare.gov on November 1st of 2017, these plans will rise to the top of the screen. And as you know, there are a lot in the private sector, there are people who pay to be on the top of the search list. And so they hopefully will get more enrollment because of this, which will save us more money, but also will help them as well. So it's hopefully doing the right thing is also good business. That's the idea here. I also should point out that we did, just speaking of the Walker administration and trying to rig the healthcare system, put out a release yesterday that shows that they have a large number, much larger than we knew, of substandard non-ACA compliant health plans, and that these are actually raising the rates on the ACA exchange by at least 10%. And we learned that last week from Senator Johnson's hearing, when the Deputy Insurance Commissioner gave a much larger number of people in those plans than we thought. And that undermines the cost of health care for people who used to have pre-existing conditions, now buy it from the Affordable Care Act, but also leaves those people with plans that may have huge holes in them, and that may be a rude surprise if they ever unfortunately have a major illness or injury. And so I want to point that out, that the rigging of the system to sabotage health care reform does go on, but today we haven't to announce something we're able to do without the Walker administration to save over $220 million for health consumers. So if there are any questions for any of the speakers, now would be the time.
So Robert, this is 5 out of how many?
Well, there are on the individual market at least 24, I believe, is the number. So it is, but these, we don't know if all the others aren't going to do it. They don't have to say till November 1st. These are the ones that are willing to announce to, through us that they were doing it. But hopefully there are more. But it's still a lot. It's still a lot of people. But you're right. There are a lot of insurance companies not doing it. And we also have some of the large for-profit companies pulling out of the Affordable Care Act, partly because they're upset about the antitrust suit that the Department of Justice filed against them. So some of them might not be doing it, but they may not be in the marketplace either, some of those. But good question. Yeah, there are still a lot of others that should be doing it. Of course, their plans will be lower on the search list, so hopefully, hopefully that will, if they don't do it, will be instructive. Any other questions? For myself or the representative or the senator? Okay, well, we'll be available and for further comment later, and we thank you for joining us. Thank you very much.